Hi, today's topic is E&M. E&M guidelines overview. In medical coding, E&M stands for evaluation and management. So the E&M is for providers' time and work spent to evaluating and managing a patient's care rather than performing a procedure. Some common types of E&M: office or outpatient visits, 992022 99205 for new patient visits, 99211 to 99215 for established patient visits. These are the most commonly used E&M codes in outpatient settings. Next is categories: office or outpatient services, hospital inpatient or observation care services, consultations, emergency department, nursing facility, home or residence, prolonged service. So initial service and subsequent service. Initial service is when the patient has not received any professional services from the physician, same group or same specialty. Different group, different specialty, we cannot consider as initial. Subsequent services when the patient has received any professional services from the physician or other healthcare provider within the 3 years. So the level of E&M services, the appropriate level for E&M services based on the following. So there's two types of levels we need to check to select the appropriate CPT codes for E&M category. So this E&M category have different sets of codes based on the levels. So the first one is the level of the MDM as defined for each service. And second one is the total time for E&M service performed on the date of the encounter. Guidelines for selecting level of service based on the medical decision making. First one is the number and complexity of problems that are addressed during the encounter. So the numbers and complexity of the problems, for example, some fever, and this is self-limited, so we can give only one number, but the complexity is not there. For a fever is a self-limited only, not a complicated one. We can cure by ourselves by paracetamol, or we can go to the pharmacy, we can collect some paracetamol. So this is the number. And the fever due to corona, COVID, so this is the complexity, so we can give the number 2 or more than. So this is the number and complexity to select the level. So next one is the amount and the complexity of data. So for COVID, sometimes we need to check the X-ray, chest X-rays. We need to take some CT, ultrasound, like that. So this is the data. So the data to be reviewed means it will give one more point. So this is the amount and the complexity of data to be reviewed and analyzed.